My name's Teresa. I've been living in Waltham since I was 7, which is too many years to think of. It's a lot. I grew up and was schooled here, going to the local schools and through the education system. I went through girls' schools when I was here, and that was a challenge because I was aware that I was slightly different from the other girls in my class and my year, although some people had crushes, would talk about crushes on their teachers, and some of those were women, especially the gym PE teachers. So I was trying to look at my own sexuality through school, and I'm sorry that there wasn't more done in schools to help people like me to explore that and understand that. So I'm glad now that more is done in schools and that Section 28 is no longer in place, and so we've gone a long way. So when I became a nurse and I trained locally, I did have a relationship with another nurse when I was a student, and when that was unravelled, as we say, although there's lots of lesbian and gay people within the NHS, it just wasn't spoken about. And when I was a student, the people that were there that were known to be lesbians, the language and the conversations were derogatory, so you knew not to come out. And again, that's changed a lot. But when I was a student and it was discovered that I was in a relationship with another student, they first of all asked me to leave, and then we had a discussion about whether or not I should ever work on a women's ward. So again, my debate and discussion around that was to say, well, we have male nurses, do we stop them working on women's wards? So I wasn't stopped and I was allowed to carry on with my training, but I'm really glad now that so much has changed, that there are lesbian and gay groups in the NHS, that the Royal College of Nursing have groups, that there's policies, and so much has changed for people within the NHS system. And it's not a big secret whether you're a lesbian and gay person within the NHS. But you know, through all these things, we've had to struggle through being a child in school, within the workplace, and organisations like Stonewall have helped to move a lot of that on. So as an adult then, I've wanted to do things that help other people not only just come together, because you can be very isolated when you don't know how to link up with other people. So I was one of the co-founders of an organisation called PACE, which is a very big counselling organisation in London, and provides support for lesbian and gay people who have mental health or depression, or helps them with employment. At the time it was purely a counselling service, but that's now expanded over the many years it's been going on, because there wasn't any services specifically for lesbian and gay people, and the health sector wasn't necessarily geared up for lesbian and gay communities. There were women's services, but not necessarily targeted at lesbians, and we know that there are many health issues related to being lesbian and gay. For example, mental health, excessive smoking, alcohol use and drug use. So we know that these trends are quite common and higher within lesbian and gay communities, partly because of the environment that we live in. So I helped to establish PACE. I now run a group in Waltham Forest. It's a lesbian tea group, and that again is where it's spread by word of mouth, and where lesbians in Waltham Forest can come together. It's usually one Sunday every 2 to 3 months. We meet up at somebody's home. It's hosted by one of the members, and everybody brings something. It's a bit like a potluck. And it runs from 3 till 6, and talk about anything, anybody's welcome, and we eat and we talk about all sorts of things. I did a lot of work in HIV and AIDS in the very early days, and when it was the very early days of HIV, and they were very, very difficult times. And my partner then, she worked in a nursery, a children's nursery, and when they discovered that I worked in the field of HIV and AIDS, they wanted her to leave because they thought that she would bring AIDS into the nursery, and they suspended her. And we had to get people in to talk to the parents and the governors and everybody else. So we organised, because I was in the field, one of the top doctors, specialists in the field, to come and talk to them. And then, because there was lots of myths around, and in the end, they realised that some of their fears and anxiety weren't founded, and they gave her a great big bouquet of flowers and said they were really sorry, and that was really good, but at the time it was extremely stressful. And through that work we did a lot towards developing policies for health and social care, to look at how we work with people with HIV and AIDS, and about policies and about loan schemes and services and service development specifically. And that was very good, but as I said, it was very distressing, because at that time many people that we either worked with or that I knew through the Lesbian and Gay Centre, as it was then in central London, many people were dying, and it was very distressing to see a whole kind of layer of people, peers that you knew, dying, and there was nothing that you could do about it. And we were in an environment that was very not very kind. So I'm glad that things have changed. My worry now is that we've swept it too far under the carpet, and I think that we still need to be aware and to educate people about preventing the spread. It's not just in lesbian and gay and drug misusing people, but heterosexuals, particularly older people who are remarrying and getting into new relationships. But also, I'm glad that the things that we had to face, younger people don't. We now have marriage, we had civil partnerships, fantastic. So I'm delighted that same-sex partnerships and marriage is now in place. But I think that we mustn't be complacent, that there's still a lot to do, and we must still keep aware that we need to break down the barriers and ensure that equality happens across the piece, and that discrimination doesn't happen, because it can be subtle, and we must be vigilant. So I'm hoping that the young people coming up will be political and observant, and carry on the struggle that many people, even before me, but during our time as well, carry that on and ensure that we hit complete equality across the whole community. And things like this, I think the LGBT History Month is really important, because it allows people from all over the borough, but nationally, to acknowledge a lot of lesbian and gay people who came before us and are currently here with us, and to celebrate that and to be able to talk about it. Lots of lesbian and gay people have done huge things, and that has never been acknowledged. If anything, a lot of negative things have been acknowledged around lesbian and gay people. So it's good to celebrate the good things that have been done, and to start to break down the images and the misconceptions and the misinformation that have happened over many of our lifetimes, so that famous writers and famous people who've done things can be acknowledged for their very, very hard and valuable contributions to society.